right to start, Raquel?
Yeah, sure.
Sure. Okay, thanks very much for inviting us to present on the SISTAQUIT and iSISTAQUIT studies that we're conducting at the University of Newcastle. And I'd like to just apologise that Gillian couldn't be here, but we're all very excited to share our program with you. Next slide, please, Ben. Okay, so first of all, this is the SISTAQUIT and iSISTAQUIT teams that we have. So SISTAQUIT is the randomised control trial part of the program, and the SISTAQUIT team are based in the Hunter Medical Research Institute at Newcastle. The iSISTAQUIT team is based up in Coffs Harbour in a new research facility up there, and we're really happy to have such a multicultural, great team in both locations. So we've got Indigenous and non-Indigenous Australians and New Zealanders. We've got research, academics, clinicians, including GP and an Aboriginal obstetrician. And we've got members from overseas. So we've got Bangladesh, Ethiopia and Brazil represented. So it's a great team to bring overall strength to the program. Next slide, please. So the importance of helping women to quit pregnancy is very dear and close to our heart. And we know that smoking is the main risk factor for low birth weight. So it's very important for the outcomes of not only the mother, but the baby and ongoing generations. Improving birth weight is one of the new Closing the Gap targets. And currently around 44% of pregnant Aboriginal and Torres Strait Islander women smoke. And as we've seen from Tom's presentation earlier on, there's higher rates in remote and very remote areas. We know that women are motivated to quit, but they do not get enough help to quit. So the SISTAQUIT program came about after a needs assessment, if you like, that health providers needed resources and further training and information so that they were confident to help provide assistance in smoking cessation to pregnant women. We also know from surveys that training of providers can double quit rates. So it's really important that programs like this be rolled out into health providers. Next slide, please. Okay, so early on in this program, we thought we would have a look at what are Australian health providers offering. So you can see from this graph that across a high sample size number of GP and obstetricians across Australia, that 91%, so a good amount of clinicians are excellent at being able to ask and advise about smoking. They're fairly good at assessing the motivation for smoking, but then it starts to drop off as far as being able to assist with smoking cessation, assist with a quit plan, and even only about a third are arranging referrals for people across to smoking cessation experts. Next slide, please. So this is how SISTAQUIT and iSISTAQUIT came about. So in 2016, we conducted a phase 1 study called I Can Quitting Pregnancy. This was co-designed with Aboriginal and Torres Strait Islander people, and it was pre-tested in 3 AMSs in 3 states. We looked at the suitability of materials for helping health providers to provide smoking cessation to pregnant Aboriginal and Torres Strait Islander women. And in 2016 to 2017, we conducted phase 2 of that pilot project. And this was a pilot study in 6 services across 3 states. And we looked at the feasibility, acceptability and effectiveness of the I Can Quit resources that we developed for health providers. In phase 3 is where it's currently the SISTAQUIT program. And as I said, SISTAQUIT is a randomised control trial, and it's looking at the SISTAQUIT implementation versus standard care across, it's actually 20 services, not 22, in 5 states. And we're looking at the effectiveness, obviously, between the SISTAQUIT program, so that's the training and the resources that we're providing for health providers. And that has then led into the phase 4 of the study, which is started this year and will run to 2022, called iSISTAQUIT. And Alison Hart will be presenting more on the implementation side of the study, the program. But it's looking at implementing SISTAQUIT in a further 20 services nationwide. This is in mainstream and AMS services. And we'll also be looking at a scale-up project or a phase 5 project in 2021 to 2024. And this is part of a current GACD proposal. So we're very grateful for the funding that we've received, you know, especially for the Department of Health with the iSISTAQUIT program, because it wouldn't have been able to be implemented without that funding. Next slide, please. Okay, so we use the ABCD approach in SISTAQUIT and iSISTAQUIT. Quite easy, the ABCD, so everyone's familiar with ask and assess smoking, brief advice to quit. But then we're looking at those things that I mentioned that when health providers are not doing quite so well. And I should probably say that what we're seeing in Australia and New Zealand is consistent with global health providers in what we are doing well and what we're not doing so well. So the cessation part of the program looks at behaviour change techniques, and that includes the use of nicotine replacement therapy, which has been shown to be safe in pregnancy, but is not generally something that is prescribed that often. So the SISTAQUIT program, besides providing the training for health providers, the resources they need to develop quit plans and, you know, helping a pregnant woman to cease smoking, it's also encouraging the use of nicotine replacement therapy, which is much safer than smoking. And the D stands for discuss. So discuss in the family, social and cultural context. So it's a very culturally specific, tailored program, is the SISTAQUIT program. Next slide, please. So what's the difference between SISTAQUIT and iSISTAQUIT? So SISTAQUIT was funded by the National Health and Medical Research Council and the GACD. So it's a global alliance funded project as well. As I said, it's randomised trial in 20 services, and it's training in culturally competent, evidence-based care for smoking cessation in pregnancy versus usual care. We collect health provider and service level data, and we also collect data from the pregnant women that participate in the SISTAQUIT trial. And that's collected through our wonderful research facilitators at the 20 SISTAQUIT sites that we currently have. The data on the women is looking at their social and emotional well-being, their smoking cessation, like their past quit experiences, things like that. And if the woman consents, their baby is also followed up to 6 months of age. And for the babies, we're looking at things like respiratory illness. iSISTAQUIT, as opposed to SISTAQUIT, it's funded by the Department of Health and TIS. We're very grateful for that funding and support from TIS. It's an implementation part of the program, like I said, and it's in 20 or 25 services we've got at the moment, and always accepting more services. So the difference between iSISTAQUIT is that all the sites get the training and resources, whereas in SISTAQUIT, you're either randomised to usual care and you get the resources at the end of the study, or you get the resources and training because you're in the intervention arm. So with iSISTAQUIT, all the sites get the training and resources to start with, and the data is collected at the health professional and service level. So we're not actually recruiting women and babies to this phase 5 of the project. Additionally, there's a social media campaign. So we've done previous analysis on what social media smoking cessation care there is out there, and we would ideally, and what we're working with Gillian actually, is in developing an iSISTAQUIT social media campaign to fill those gaps in the evidence. And next slide, please. Okay, so currently we've got, we did recruit 23 services originally to SISTAQUIT. We have 20 at the moment. 17 of those are ACCHS and 3 are mainstream. We have 7 TIS regional teams, and they're Punapima, Wurundjeri, Kabul, Catherine West, Danila, Dilba, Wabakal and Galambilla. We've got 90 health providers and 68 women recruited to the trial so far, and 9 babies. And due to COVID and prior to that, the bushfires that affected some of our sites quite significantly, such as Katungal, that trial has been extended to early 2022. So due to COVID, we had a temporary halt in the recruiting because there was no face-to-face recruiting during the first stage of COVID and the lockdown. However, we're back to recruiting in the services, and we have always been encouraging the SISTAQUIT sites to follow up with their participants regularly, either over the phone or through video call. I suppose as a further incentive for collecting data and survey information, we have ethics approval for incentive for health providers to complete surveys, and we also have an incentive for a mid-study implementation interview with staff from the services, and that's just looking at what has been the challenges of implementing SISTAQUIT in their service. Next slide, please. So I'll hand over to Ali for iSISTAQUIT.
Hi, thanks, Nicole. Can you hear me? Is that all right?
Yes.
Yeah, okay. Hi, my name is Ali Hart. I'm the Aboriginal researcher for SISTAQUIT, and part of my job is recruiting the services that have shown interest in participating with our program. So at the start there were 40 services, both mainstream and HO expressed interest with SISTAQUIT program. So chasing them all up. Out of all of them, 25 services are ready to sign with us at the moment. There are 14 mainstream services, 14 AMSs and 11 mainstream services out of the 25 that are ready to sign. And we're still generating interest and for participation with our program, which is really great. Part of recruiting and talking with all the services is been a highlight of my job, because it gets to know the services and the community as well, and their role in playing that community, especially with the mums, and having that conversation with smoking cessation. With all the sites, they get all the training and resources that come with our program. Part of that is our self-paced e-learning, and with all of that, it comes with the NRT therapy. I'll probably have to go over to the next slide, but yeah, thank you. So part of our training that we're going to distribute is it comes with the treatment manual and the flip chart. So the treatment manual is for the health provider. It acts as a guide to break down the training that comes along with the online training, And with the online training, as you can see, the roadmap down below, it has the start, where to get starting, and has the acknowledgement of the country. Also the culturally safe healthcare, to make sure that when having that conversation with the mum, that she feels that she's in a safe, to have that conversation, because we know when talking with our mums, they feel shame, and you know, some don't want to admit that they're smoking, or you know, when they, but some of the training clearly outlines that as well. So as you can see, that from what Nicole touched on, training involves the ABCD approach, and it just sort of sees on the roadmap there, how it breaks it down. In each part of the training, you have the ARCs and assess, the brief advice, cessation aids, the BCT, the NRT, and it also addresses the barriers what our mums have to face when giving up smoking, and that that the health provider would recognise that, and to talk a bit with the mum as well. It also comes with the flip chart as well, to talk with the mum. So the health provider gives time to sit with the mum and go through all the information, as well as the advice with smoking, giving up smoking. It also comes with the patient booklet for the mum to basically go with her progress, just to keep track of her progress as well. Also, the resources that we go out will be posters, just any social media campaigning as well. We also distribute all NRT supplies, which include the lozenges, the inhaler, the patches, and also as well as the gum. And part of the training as well is the information around giving the mum and the health provider about the NRT as well. So the e-learning modules, as you can see, it is part of the roadmap, and it does break it down there. But it also limits down about 4 hours at a self-pace as well. So you can come back and do it whenever you like. It all depends on the health provider's time frame, if they can. It all depends on their workload, and it'll work and to cater to their workload as well, so they can come back and do it, and wherever they left off. Next slide, please. So we've been looking at different media campaign about smoking cessation, and I have to say there's some really great quit smoking campaigns around Australia with our community. There's some really great, and they really touch on the message as well. With the social media advisory that we have, we pretty much have a panel that's going to help advise us and get us on track with social media and putting out the right message and make sure we stay on point with that. We're working with Galimba, and we're hoping to film in different locations to get our social media campaign out, but it's not sure at this moment, so we'd have to work to find locations to get our to do our filming. So we're all working on different channels with our social media, with Facebook and Instagram. So we're almost there. That we'll definitely get there. But if you do have any interest in any questions or interest, I have my details, and you can contact me personally. I'll happily go through anything with the training, and if you have any questions or anything, I'm happily available to answer anything and to have a yarn and to catch up as well.
So I guess we're having a change of speaker at this point in time. Can anyone hear me clearly? I'm using Nicole's computer, but my name is Tabassum. So the last two slides of our presentation is just to do a little bit of promotion of some more work that we are doing on smoking cessation. So firstly, we have Which Way. It's a study which has been designed by and is being led by Dr. Michelle Boville, who's an NHMRC Early Career Fellow. She's conducting this study looking into preference for cessation methods among Aboriginal and Torres Strait Islander women. So, so far we have 302 surveys completed, mostly from New South Wales and Queensland, but it would be great to have more voices represented from other states of Australia. We have the survey link at the bottom of this slide, and Michelle's contact detail is also here. Which Way, as a study, it has got its own Facebook page and Instagram as well. So anyone interested in that study can have a look into that as well. Next slide, please. All right, so this is another study that we're planning to do. So this image on the left side might look a bit familiar to some of you, because I remember I presented this model in a couple of conferences, and I can see some familiar faces in the audience. So I will be doing a study basically looking at prevention of relapse when Aboriginal and Torres Strait Islander women are trying to quit during pregnancy or during postpartum periods. So for this study, we're using socio-ecological model as our framework for this study. So for this part of this study, we are looking to speak to TIS team coordinators because they're experts in what they do, and they're working very closely with the community. So we would really like to learn from them about what are the barriers in preventing relapse from a system perspective, I guess. And so we're basically looking to have one-to-one conversation for half an hour or so to the max. We know that everyone is very busy, and we just don't want to add any more burden on that workload. So we'll try to keep it as low as possible, but half an hour is the max. So anyone interested in participating in this study can directly contact me, and I have my email address at the bottom. Yeah, so I guess that was it from us today, Nicole.
Yes, that's it. So
thank you for having us once again.
Thanks, Ben and Nicole. We're finished, so if anyone's got any questions, happy to take those.
Yep. Sorry, it's just Marianne here. Just wondering if you've got any services in Victoria who have signed up for the programs?
So for SISTAQUIT RCT, we have one service in Victoria.
you know, we would have loved to have, we'd love to have more. And whether they, like SISTAQUIT itself, it's mostly closed off as far as recruitment. But if other services in Victoria were interested in iSISTAQUIT, then just reach out to us, and we're more than happy to provide information, further information on this, on that study, and welcome sites in Victoria and all over Australia to that study. We're quite fortunate for iSISTAQUIT in that we've got 4 Victorian sites at the moment.
Who are they?
We've got the Curie Maternity Course and Wellbeing Unit.
Which
We've
hospital?
got the statewide tobacco control, Southwest Healthcare, and Gudrunjamara Health Service in Victoria. So the iSISTAQUIT is across mainstream as well as Aboriginal services.
Are they led by their KMS units, the Career Maternity Services?
Sorry, I couldn't hear that, Lionel.
Are they led by their KMS units, which is the abbreviation for Career Maternity Services?
Sorry, we can't hear that. Are they led by who? Curie, is it?
Led by the Career Maternity Services, KMS.
No, not that I know of, but Alison may be able to answer that question because she's more involved in iSISTAQUIT service engagement. You there, Ali?
Yeah, we're working with KMS at the moment, and we're looking to, but we're still trying to negotiate what sites we can have. So it's just, we're just at that, that's where we're at that point. But we've been engaged with KMS, led by KMS. Yeah. Yeah, they gave permission for Gunditjmara to proceed with us while we're in the process of engaging with them and moving forward with them.
Any more questions for Nicole or Alison?
Yeah.
No. Okay.